Most jaw surgery patients will have bleeding and oozing from the surgical sites for the first 24 to 48 hours. Upper jaw and nasal procedures will have more bleeding and oozing than lower jaw procedures. Nosebleed should be expected with upper jaw surgery and can happen with lower jaw surgery as well from the breathing tube used with anesthesia. Sometimes nasal packs are placed and should only be removed at your postoperative appointment unless otherwise directed. If bleeding persists or you have unusual drainage, please call our office immediately. Ice packs will minimize the degree of swelling that takes place after the surgery. The swelling a patient experiences is dependent on the length of surgery, type of surgery, complexity of the surgical procedures, and individual patient responses to surgery. Swelling typically increases for 72 hours and then will taper and diminish over the next 7 to 10 days. Bruising will begin to appear approximately 3 to 5 days after the surgical procedure. Upper jaw surgical procedures will have a tendency for more bruising, redness, and color presentation around the nose and below the eyes. Typically, the bruising persists and expands over 7 to 14 days. Please keep ice packs over your surgical site for the first 24 to 48 hours for 20 minutes on and 20 minutes off. For upper jaw surgery, the ice packs are laid across the bridge of the nose and on the cheeks. For lower jaw surgery, the ice packs are placed along the side of the lower jaw on both sides. You are encouraged to eat as soon as possible after surgery, beginning with clear liquids such as water or apple juice and advancing as tolerated. Soft, cold foods like ice cream, pudding, and applesauce are recommended on the first day. Soft, warm foods like mashed potatoes, pastas, and soups can be introduced the following day. Do not eat hard, sharp foods like chips, nuts, or seeds, as these may be lodged in the surgical site. Stay upright as much as possible and rest and sleep at a 30-degree angle in a recliner or bed for the first 72 hours after surgery. Avoid bending over or lifting heavy objects for 2 to 3 weeks following the surgery. Avoid unnecessary activity for the first 72 hours other than short walks several times per day. Longer walks may be started after the first 3 days. Patients should avoid running and lifting more than 30 pounds until 6 weeks after surgery. Patients should avoid any contact sports or potential facial, jaw injuries or trauma for 8 to 10 weeks. Most patients are able to return to school and work activities 7 to 10 days after surgery. Patients should consider returning to work or school part-time for several days before attempting a full schedule and a full workday or school day. Avoid extremely hot showers and extremely hot baths for the first 2 days. Avoid heavy showers or shower spray on the surgical wounds and surgical sites. If prescribed topical antibiotic ointment, it should be reapplied on the facial incisions immediately before and after bathing. Please report any of the following to our office immediately: excessive pain or excessive bleeding, itching or rash around the surgical sites or rashes secondary to any medication, temperature above 101 degrees orally, excessive swelling or bruising, excessive fatigue or depression. Please do not hesitate to call our office at any time, day or night, with any questions or concerns.